Hello and welcome to the show. Skin treatments and cosmetic surgery are readily available to us today more than ever before. I have lots and lots of questions regarding this industry myself, and I'm sure that some of you do as well. And to help answer those questions today, I'm joined on the show by Dr. Tahira Bojani Lynch, who's a doctor and surgeon at the Laser and Light Clinic right here in Leicester. Very good afternoon to you. Welcome to the show. Thank you for coming in. Right, okay, so the cosmetic surgery and laser treatments that you do yourselves at the clinic, I know that you'll be doing some presentations and practicals for us a little bit later on, focusing on particular treatments. But in general, tell us about what kind of treatments you provide at the clinic yourselves.
Well, we're a cosmetic medical clinic, so we do non-surgical cosmetic treatments here, even though I am a qualified surgeon. In a clinic like this, they're non-surgical, what we would call lunchtime procedures, that you can come in, have a procedure done that doesn't require any cutting, generally injectable type treatments, and you can go out in an hour or so's time looking and feeling pretty good.
So quick fix cosmetic surgery?
You have to stop using the surgery because we don't do surgery, but they are quick fixes, but they are long lasting and they do a fantastic job.
Okay, so you're based here in the heart of Loughborough in Leicester. Tell us about the other treatments that the Laser and Light Clinic provide here.
Well, we do, as I said, non-surgical medical interventions like botulinum toxin, dermal fillers, but we also have a laser hair removal clinic, and we specialise in treating darker skins with a all singing, all dancing, pain-free laser that does large areas of laser hair removal on dark skin without hurting people. Okay,
and tell me a little bit more about yourself as well.
Well, I am an ophthalmologist, so I am an eye surgeon. I specialise as a laser eye surgeon, and I also do laser skin treatments and cosmetic skin treatments. Most cosmetic products like botulinum toxin, dermal fillers began their lives as ophthalmology drugs. We use them in cataract surgery, we use them to treat squints. So most of the earliest and most experienced cosmetic doctors began their lives as ophthalmologists, as I did.
All right. In general, the cosmetic industry, surgery industry, I know you don't want to use that word, but in general, the industry has had a little bit of flack recently.
It has.
Quite a bit, where ministers have actually sort of labelled it as a cowboy industry. Okay. What are your views on that, and how can you provide consolation? Well, that's why you would come to a medical clinic where you are being treated by a doctor. Sure.
Okay, and you don't go to a beauty salon where a beauty therapist is offering to inject you with stuff in your face. Right. If you want to be protected, and you want to be safe, and you want to look good, and you want to be looked after, come to a medical clinic.
Sure, make sure it's safe as well at the same time. All right, with the treatments that you want to talk to us about, under eye dark circles?
Under eye dark circles. Dark circles are caused by a number of things. They're partly an aging process, but a lot of young girls, and particularly Asian girls, have a genetic darkness under their eyes and can often have it from their teenage years. And this is a condition that can be very easily treated with an injectable dermal filler, and we lift the tether of the skin from the bone with a little bit of gel. It's long lasting and it looks fab, and you can transform somebody's life. Where we have girls who have not left their house without concealer from the age of 15 can suddenly go out without makeup on.
So we can see that this young girl has got dark circles and bags, and this is how she looked 4 weeks later with no makeup on.
Is that a very quick procedure then?
It takes about half an hour to 45 minutes. A little bit of swelling and bruising afterwards that'll take a few days to settle in some cases. But it is...
Is this one of the practicals we're going to see later?
We're going to see that later.
We're going to see that later on. All right. So very quickly, again, the industry itself has seen a massive boom recently as well. Why do you think that is?
Well, there's nothing nicer than looking in the mirror and liking what you see. Okay, how you look and how you feel are completely interrelated in your head. So if you think you look good, you will feel good. You smile more, you're nicer to people. That's just how we are as people. If you look in the mirror and you don't feel good, or you don't think you look good, you will feel less of yourself. So anything that will make you look better will make you feel better. Remember, these are medical treatments. They are minimally invasive, but they are invasive. So you need to come and have a consultation with a doctor who is going to make sure that you are suitable for the treatment, and then we can go ahead and make you feel the best version of yourself.
That in general is true, but why the boom exactly? Why are the numbers rising so much? I mean, liposuction, I think, was the highest climber last year, wasn't it, with around 41% increase.
We don't do liposuction here, so I can't speak specifically about liposuction, although we know that generally speaking the population is getting more overweight, so one would expect that there would be an increase in people looking for quick fix solutions to being overweight. But certainly the boom in the cosmetic industry, or in the cosmetic medical industry, I think is because these are treatments that work, they are treatments that last, and there is a preventative effect when you inject something like hyaluronic acid under the skin. Aside from filling a line or a wrinkle or improving a dark circle, for the period of time that substance sits in your skin is younger and healthier. So people who have regular treatments of this kind will not age as badly or as quickly as those that don't. So irrespective of the fact that you're having a treatment or filling a line, you are actually making your skin younger, and I think that is why these treatments are set to continue to increase.
Sure. Well, as you're a professional in the industry, and you can offer that kind of advice to us. When an individual does go for, say, cosmetic surgery, Botox or whatever, does that the areas that they've worked on, will they age with the rest of their body as well? You know, or does it, as time goes on, will they age and those areas remain a little bit different?
No, what happens is, for example, with Botox, which is a medicine that you inject in the skin that stops the muscle from contracting, something slightly different to a filler, the muscle contracts less, so that particular skin creases less, so over time it ages less quickly. Okay. So there is a preventative effect that you get with Botox. Similarly with hyaluronic acid fillers, that skin ages less quickly. Obviously you yourself will age at the age that you're going to, but generally speaking we gauge people's age by their faces. Generally speaking, sometimes your hands give you away, sometimes your neck gives you away, but generally speaking we gauge someone's age by their face. We live younger and healthier lives. I remember when my mum was 50, she thought she was an old woman. I'm nearly 50. I don't consider myself as an old woman. I consider myself a young person. Absolutely. And I think because we live younger lives, we need this to match this.
Right. Okay. Lovely, lovely. Right. Okay. So after the break, we will be experiencing some practicals from Dr. herself, and under eye circles, and is there another one as well that we're looking forward to?
We're going to do a couple of demonstrations of under eye circles, one where we've got a bit of hollowing and one where we've got a pure dark circle.
Fabulous. See you after the break.